Hello and welcome to the first session of the medical debate, where today we will be going through the Ethics 101 session. In this session, we will be introducing you to medical ethics rather than going into any detail, and we will be talking about the four main pillars of ethics, as well as other factors which you should consider and know as part of your medical application. How to make the most of these sessions. So on Vimeo, you should be following along with the video. Most have been designed with the breaks built in, so they can be played from start to finish, and you will have enough time to answer questions. You can comment as much as you want below the video, and actually we urge you to comment as much as you can below the video, whether it is your answers to questions that we ask in this video, or even questions to do with this session, or possibly sessions you might want to see in the future. So what are ethics? At this point, I urge you to write a few suggestions down on a piece of paper and just take a minute to do this before we delve into the world of medical ethics and we think about what specifically relates to medicine and your medical application. I'll give you 1 minute to write down some answers and think about what ethics are and try and link them to medical ethics. If you would like to skip the video and not write down and you would just like to listen to the answers, then you can skip ahead for 1 minute and then you will be able to see the answers. But if you would like to write them down, your time for 1 minute starts now. Four, three, two, one. Okay, so that was 1 minute up, and we're going to look at the actual answers. So ethics are moral principles that govern a person's behavior or the conducting of an activity. We need ethics and morals to guide us when we make choices so as to make decisions that benefit as many people as possible, as often as possible. In medicine, it is key that you have a strong ethical foundation, so you know what to do in different situations and difficult situations without feeling guilty or hurting others. In fact, as a doctor, you will come across many difficult, ethically demanding situations, and you should know how to approach them. You will also need to be an ethical person to do well in the situational judgment section of the UCAT exam, which many of you might be taking to apply for medical school, which is based on your ethical views. So these sessions should be very helpful from that. And we actually do cover some example questions. So what does it actually mean for medical practice to be considered ethical? So there are four pillars of medical ethics, as we have termed them. So every decision that is done in medicine should be done with good intent in mind on the doctor's part. So the doctor is doing that decision to help the patient, and this is known as beneficence. You should try and harm patients as little as possible, both emotionally and physically. Of course, this is not always possible with surgery, etc. But you should try and minimize the damage done to the patient. This is called non-maleficence. The patient has the right to make whatever choice they want without you coercing them. And as doctors, your job is to advise them. And this is known as autonomy. And you have to make sure that the treatment of patients is fair and obeys all laws. We will look into this one in a second, and this pillar is called justice. These four pillars are very important for you to know for your medical application. So it's highly likely that you will be tested on them. So we recommend that you watch this video again and again, learn about these four pillars and try and apply them to situations you might see possibly in exam questions or just in real life. And maybe if you're doing some wider reading in medicine, we highly recommend you listen to these lectures alongside it and apply these medical principles on those things that you're reading. So we're going to do a question, and we're going to do an ethical dilemma. So there has been a terrible accident. Two cars have crashed on the motorway. One was a van full of 10 patients, and the other car was a saloon car with just one person inside. You are the doctor in charge at the hospital. When you come in, you find that the patient from the saloon car is much more wounded than the 10 patients from the van. You have enough medicine in the hospital to treat all the 10 van patients, or just enough to treat the patient from the car. Which do you choose? Now, I should make this clear that if you choose to treat either the one person inside the car or the 10 patients from the van, the people in the other vehicle will pass away. And you have enough, when it says you have enough medication, whoever you choose to apply this medicine to will guaranteed be saved. So I'll give you 30 seconds to think about, in this scenario, which person would be more ethically correct, or which one would you choose? Would you choose the 10 patients inside the van, or would you choose the one person inside the car? Who would you save as a doctor? Your 30 seconds starts now. Okay, so your 30 seconds are up, and we hope you put your answers in the comment section and let us know who you would choose. Try and use some ethical reasoning behind that answer, and we would love to read your answers at the end. So try and explain your answer with some sort of reasoning. Okay, this experiment, this thought experiment, could actually be made more interesting and arguably more difficult. So let's try that. Now, what if we say that the person in the saloon car is a very close family member of yours? So now, just to recap, in the two cars, you have one van full of 10 patients, and in the other car, with the saloon car, with just one patient inside. However, this one patient is your close family member. For example, your brother or your sibling, your direct sibling, or your parent, one of your parents. Which one would you choose to save now? Again, there are no right or wrong answers because this is ethics, but you should always try to back up your answers with some sort of clear reasoning based on your ethical beliefs. Again, I will give you 30 seconds to come up with an answer. Please, please, please feel free to put your answers in the comment section and answer the questions and let us know what you think. And your 30 seconds start now. Okay, so that is your 30 seconds up. We're going to take it one step further to make this even more difficult before I talk through some of the options that you guys might have put down on the comment section, which are the most common answers. What if the people in the van were 10 children? So just to recap, now you have one van, which is full of 10 children, and the other car is a saloon car with just one person inside. Now, if you would like, you can make this one person a very close family member, or you could make this one to make it a bit more difficult and challenging and stimulating, or you could just make it one random person. So, what if the van was full of 10 children? Who would you pick to save as a doctor at this point? I'll give you another 30 seconds before we talk through some of the possible answers. 30 seconds starting now. Okay, so that's your 30 seconds up, and we're going to talk about some of the answers. So, first of all, I want you to ask yourself, what was your thought process and what final solution did you come to in each of the three questions? For the first question, one of the answers could have been that you choose 10 patients. This is probably a common answer because you want to try and save as many people as possible. And the fact that you can save 10 people rather than just the one makes ethical sense. But then we complicated things a little. What if the person in the saloon is a very close family member? Some people might be urged to say that they'd rather save their family member. And there's no shame in this because, again, ethics has no right or wrong answer. And it's a very difficult situation to be put in. So we'd never know how we could actually react unless we were put in this situation. But again, it's a very important thing to think of both sides of the argument and think of what you would do in this scenario. And in the last scenario, what if the people in the van were telling children? Now, if the van had 10 children, but the saloon car had just one random person inside, maybe you would default to the answer that, there are 10 people. And rather than saving the one random person, you could save 10 random children. Um, and maybe it's not the fact that they're children that matters here, but the fact that you're saving more people. But then you could also look at, let's say, if we said that there were 10 children and then there was one very close family member, again, it would be very difficult to choose because 10 children, the family member might not be so young, they might have less of their life left. But then if you're saving 10 children who have the majority of their lives ahead of them, it would be very difficult to choose between the two. But then again, it's very important to make critical decisions and always, always, always provide some reasoning for your choice. So we would love to see your comments in the comment section where you could write, what you came up with, what your thought process was, what your ethical reasoning behind your three choices were. And we would love to read these in the future. So please, 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 please feel free to utilize the comment section as you wish. So we're going to try an ethical question now, and I'm going to give you some time for it. And I'm going to read through it first, and we'd love for you to pause the video or just let it running. As we said, the video is created so that there are breaks built inside the video, so you can just keep it playing. You are a doctor who has just finished up work for the day and are almost home when you realize you left your patient's notes on the desk. Do you, A, tell the nurse to put them away by calling her up? Do you, B, call up your supervisor and tell your supervisor what has happened and ask them to put it away? Do you, C, go all the way back and put them away yourself? Just to reiterate, you are almost home at this point, and so you would have to go all the way back. And D, you do nothing and you put them away tomorrow when you go back to the hospital. Seeing as this is a shorter question, I will give you 1 minute to do this question, come up with some sort of answer. It is a multiple choice, so you don't have to provide reasoning, but we strongly urge you to because this will help you with your thought process. Your 1 minute starts now. Okay, so the time is up and 1 minute has passed, and we will go through the answers now. So again, we urge you to put your answers in the comment section and put some sort of reasoning so we can see what your answers are. And so it also helps you with your thought process because in an interview, you would clearly have to explain how you got to an answer. And so it's very important that you can put this into words. So again, please put your answers in the comment section for us to see later. In this answer, actually, the correct answer is option C. The reason for this is because of patient confidentiality. If it's your patient, the patient has trusted you with their information and has not trusted anyone else. So you cannot breach confidentiality by letting other people see your information, see their information. So you must go all the way back and put them away. So, in future sessions, we plan to have real-life doctors, professors, and workers in the medical field to come and give us an expert talk on ethics and medical aspects. We will be releasing these videos, just like we have for these sessions, and we will also be hosting live events on Zoom. To access these, please contact us on Instagram at themedicaldebate, or more accurately, you could email us at themedicaldebate@gmail.com, where we will be able to provide you with a link. We plan to have sessions where we go through BMAT and UCAT questions with attendees providing real-time feedback. And we are happy to answer any queries you may have at our combined emails or on the personal email addresses. Please feel free to suggest possible future events and appearances you would like to see in the comment section. If you guys have any questions, please feel free to put all questions in the comment section down below, and we will get back to you as soon as possible. To contact us, this is our email and this is our Instagram. On our Instagram, we post weekly updates on our future live sessions. And if you wish to join up with these live sessions, you can access us on email and tell us you want to join. We will add you to the mailing list. Thank you for coming to this session, and we hope to see you in the next one.